if the arteries are stiff, then the pressure goes up really high when it beats. But then when the heart relaxes, the pressure drops to normal. So you have this wide pulse pressure where you have a super high systolic with a normal diastolic. And that's a stiffening of the arteries. But we looked in her arteries and they weren't stiff, kind of, whereas she didn't have atherosclerosis. So we started talking about stress, and she goes, "Oh yeah, I worry a lot. I wake up at night and I'll be awake for 3 hours worrying." And so here you have these stiffened arteries from someone who has a lot of adrenaline, and the adrenaline like closes down the arteries. So every time the heart beats, it has to push all that blood through, and that requires a lot of pressure.
Healthy Heart webinar where we talk about all things healthy heart and the Healthy Heart Solution Kit. Also, it's primarily what we're going to be talking about today. But say hello when you guys hop on. You can do so in the chat. Also, YouTubers, Facebook. Actually, Facebook isn't working, so you may not see this there. But we're excited that you're here also. Feel free to comment. Let us know that you're watching. If you are catching this, go ahead.
Facebook isn't working for a lot of people. My son said his wasn't working, and my wife said hers wasn't working. She couldn't get Messenger up.
Yeah, it went offline, well, a couple days ago now. Or was that yesterday? No, 2 days ago. It went offline for everyone for a little bit. And there have been some weird things with it. So I can go live, but it only goes to my personal page, which is interesting. Can't share it anywhere else. So we'll have to figure that out. It's been like that for a little while. So, all right, guys, just like we did last week, if you would like to be on camera, feel free to raise your hand and we'll add you as a panelist. You'll be able to enable your camera, which is always fun. So we love to see all of you. Feel free to just click that button. It's a button that says raise hand, only if you're on Zoom. That's the only way that you'll be able to do it. If you would like to be on Zoom, the benefit of doing that versus watching on YouTube or wherever is that you can ask your questions. So I would just really encourage you to register at bartonwebinar.com, and then it'll send you a reminder when these webinars are going to happen. You'll be able to log into Zoom, ask questions, and join us. Kind of the best part is the questions, right? I think that's why most people hop on anyway. All right, so David, I just enabled you. We're going to do Sonia or Sonia, promote to panelist. Who else? Ginger wants to hop on. Awesome. Okay, feel free to enable your, actually, you know what? I think there was an issue with this last time, and I just remembered that. I'll see if I can adjust that. So it might take a minute, but then you'll be able to be on camera. All right, guys, say hello in the chat. We're excited to have you. And I might have to do it under participants. How did I do this? Don't know. Give me 1 second. I'm going to see. Yep, it's not going to work. Darn it. All right, we'll just get started, and then I have to go figure out the settings somewhere. Some settings somewhere that doesn't allow you to be on camera right away. So today we're going to talk about the basics of keeping your heart healthy. And so one thing that I love is if you guys could comment and let us know in the chat if you have the Healthy Heart Solution Kit. We'd love to know if you've used it, or if you have it, what your thoughts are. Maybe some of you are seeing some success with it and we want to hear from you. So please comment in the chat. Just a reminder that Dr. Saunders is not your doctor. And so anything that we discuss here today and you may consider wanting to implement, please just chat about that with your provider before you do so. Paul says he does have it. Awesome. How's it going, Paul? Let us know. See if I can figure out these settings. I got a lot of work to do on these settings on this webinar. Dr. Saunders can never turn his video on.
Yeah, I got my video on. I've had a couple of people lately, two of them in the last 2 days, that have had high blood pressure, and their doctors, the cardiologist, is like, yeah, we got to put you on medication. We've got, this is like really important. Your blood pressure is really high. And in one case, his blood pressure was 200 over 100. It was 215 over 110. And I don't know if you know what that's a pretty high blood pressure, to the point where his I think it was his dentist or something, said, we can't work on you. You have to go to the emergency department right now. Your blood pressure is so high, you're gonna stroke out any minute now. So over time, we looked at his risks, and we did all these tests and looked at his kidney function, his liver function, his brain function, his heart, and looked at his arteries. Did a coronary calcium score. His coronary calcium score was low, and like really low, like 30. And this is a 70-year-old guy, so he has low coronary calcium. And so there wasn't any reason for his blood pressure to go up. So we started trying different things, because sometimes if you try a medication and the medication works and you go, aha, that's the area that it's in. So I use that for testing sometimes. So in his case, that's what we did. We started giving him medication. We gave him a calcium channel blocker, an ARB, a beta blocker. We just started going through all the medications for blood pressure, and none of them worked at all. Like, he was on a beta blocker, and beta blockers lower your heart rate, and his heart rate's like in the 40s, and his blood pressure's still 200 over 110. So I'm scratching my head going, gosh, this is a really unusual case. So we tried something else called Xanax, which is an anxiety medication. And it's like, well, he didn't check it right afterward, but it wasn't really down the next day when he tested. It did make him drowsy and made him sleep, so he didn't check his blood pressure right away. And then he came in last week, or a couple of days ago, and he said, I have this weird thing. Look what happened here. My blood pressure is normal, and it was like normal, not just like down to normal. It was like 130 over 75. It was like really normal, like a perfect blood pressure. And I'm like, how did that happen? He goes, I don't know. I said, what'd you do differently? He said, nothing. I said, are you still taking the medication? Yeah. And it came back up again. I said, well, what else did you do? And so it turns out he doesn't usually drink wine, but he had wine with dinner. And then he went back and looked, and there was another normal blood pressure. Oh yeah, I had wine with dinner that time too. And so he texted me yesterday. I said, test it again. And so he had wine with dinner the other night, and his blood pressure came down to normal again. So this is a guy whose blood pressure is off the charts high, like you got to go to a doctor, because your blood pressure is super high. And then and then he drinks a couple glasses of wine with dinner, and it comes down to normal, like normal. Blood pressure medication doesn't do that. So I was wondering about that, like how does that happen, and what is that? And then I have one other patient came in today, and she has coronary calcium score is 30, and she's 72 years old. And so, which means she has very low coronary calcium. 100 is kind of moderate, over 100 is high, over 400 is high, but between 100 and 400 is kind of the moderate range. And she's like low. So, and she doesn't have any risks, and she did the Lifeline screening, and all her arteries looked good. So then I started talking to her about, why her systolic blood pressure is high and her diastolic blood pressure is low, or normal, like in the 70s, 60s, and 70s. So she has what's called a wide pulse pressure. What happens is, when the heart beats, if the arteries are stiff, then the pressure goes up really high when it beats. But then when the heart relaxes, the pressure drops to normal. So you have this wide pulse pressure where you have a super high systolic with a normal diastolic. And that's a stiffening of the arteries. But we looked in her arteries, and they weren't stiff kind of arteries. She didn't have atherosclerosis. So we started talking about stress, and she goes, oh yeah, I worry a lot. I wake up at night and I'll be awake for 3 hours worrying. And so here you have these stiffened arteries from someone who has a lot of adrenaline, and the adrenaline like closes down the arteries. So every time the heart beats, it has to push all that blood through, and that requires a lot of pressure. And then when the heart relaxes, there's no compliance of the arteries. See, normal people, when the heart beats, the artery opens up, and then the heart relaxes and the artery closes down, and you have this kind of a thing going on. But when you have hard pipes, then you have this kind of a thing going on. And it makes a really high pulse, a wide pulse pressure, a high pressure when it beats, and a low pressure when it relaxes. And so you have that. And that's what she had. So two kind of unusual cases of, it's not a biochemical problem. It wasn't a damage, wasn't a stroke thing. It wasn't a heart thing. The heart was perfectly fine in both of them. They have great hearts. And the high blood pressure was merely a stress thing. Isn't that interesting?
It's very interesting. I was in a group setting this morning, and someone had said worrying can almost become, what did she say? A habit, I think is what she said, or something like that, like where it can start to become this thing that you do all the time, and the stress of that affects you so much. I don't think she called it a habit. I don't remember like an addiction. It was like an addiction. And I just thought that was so interesting, and the effects that can have.
Well, what's kind of important is there's a reason for that. Our brains are wired to worry. And it's automatic. It's not something you have to work on. Go, gosh, I got to start worrying more. Well, some people do, but most people don't. Worry is the what we call the primitive brain, or the reptilian brain, is always looking out for danger. And you have to look out for danger. If you don't, you're going to die, right? Something's gonna sneak up on you. So you've got to be on the alert all the time for danger. And that automatic alertness for danger causes us to look around and worry and stress about things. And I asked the woman that was here today, I asked her what she worried about, and she goes, well, dumb stuff. I worry about what my guests are going to think about my meals, and I will fret about it for hours. And she says, I really have nothing to worry about. My finances are okay. I can travel. I'm exercising every day. I can walk 3 miles. I'm going to Australia next week. I don't have anything to worry about, and yet I worry about all these dumb things, like what people are going to think about something, or am I going to be able to get an appointment with that person, or things that and like waking up at night fretting over it, kind of thing. No matter what you do, you can worry. No matter where you are, you can worry. If you're in on Skid Row living in the streets, you have stuff to worry about. But then if you're Elon Musk, you also have stuff to worry about. There's no matter who you are.
Very true. Look at all these beautiful faces joining us today. If you guys want to be a part of this on video, go ahead and hit the raise your hand button on Zoom, and we will add you as a panelist. You'll be able to turn your camera on. Like Julie said, you change or transform worry into worship. I've heard. It's true. And it robs you of joy. Very good. Okay, I'm going to ask this question here that came in from Paul. If we focus on doing things to clear arterial plaque deposits, how do we get feedback that it's working?
Yeah. Feedback, it's a tough problem. There's some research on certain things that can reverse heart disease and show it on your echocardiogram, or a coronary calcium score, or an angiogram. Dr. Dean Ornish did a bunch of work on reversing heart disease, like showing that the angiogram got better over time. But that's really invasive. They're putting a catheter in your artery, putting it in your heart, and injecting dye into your heart. it's not something I would do to get that feedback. A coronary calcium score could be useful, but even when the plaques diminish, the calcium doesn't seem to diminish very easily. So people take like really high doses of vitamin K to try and get that plaque to diminish. I haven't seen results. Most of the time, I just don't repeat the study. I say, okay, you have heart disease. Let's work on heart disease. And you're not going to get feedback except that you're going to be very functional. So, you're going to be able to run a mile or 3 miles, do a 5K. And you're going to be able to play pickleball. Everybody's really into pickleball here these days. You're you're going to be able to do things, and that's your feedback. So I don't know. Feedback is okay, but be active.
We have a message here from Ginger. She said, great success with the Healthy Heart Solution Kit. Lowered carotid arteries blockage from moderate to mild. Total cholesterol down to 147.
Yeah. Okay. See, there's feedback right there. That was the carotid artery duplex study, and it improved it. Wow, that's great. I've seen that too.
Ginger, can I unmute you and can you tell us how you're feeling?
Yes.
Oh no, I guess you'll have to unmute. Oh, there you go. No, I think you'll have to unmute.
Click the unmute button, Ginger.
Okay. Hard to find. Okay, well, if you find it, yeah, sometimes it's
mine's at the top. It's the picture of a microphone.
Yeah.
Yeah.
I really feel really good. I'm slipping a little, and so I'm going to backtrack and start back over again. But I feel much better, and a lot less worry.
That's good.
Yeah.
How did you know that your carotid arteries blockage went from moderate to mild?
Ultrasounds. My doctor thought it was going up to over 70%. I did a light scan and it showed moderate, and she wanted me to get it checked. And so she sent me to UCSF in San Francisco, and they did ultrasounds, and he said, no, it's more like mild. I mean, moderate. And then he wanted me on Lipitor, which I reluctantly did. And then I looked for something else and found Dr. Saunders and started the program. And it was like 2.5, 3 months. And I got it down. And a year later, I had the test again, and it showed mild. And he said, oh, no, there's no difference in it. Nothing you're doing is making a difference. And I thought, you don't know what you're talking about. I don't think I'm going back to him. I have a heart doctor in Salem, and he's allowed me to lower the Lipitor way down, and I'm hoping eventually I will get off of it. But I know that the total probably you've said needs to be up around 200. So I am trying to modify to get back to that normal place.
Yeah. Good.
Thank you.
Good work.
Thank you.
And my A1C is 5.3.
Ooh, that's normal.
Yeah. It was like 6.3, and now it's down to 5.3.
Wow,
yeah.
Good.
Using the Healthy Heart Solution Kit.
That, and I was also trying to do the blood pressure at the same time. I mean, I kind of put them together.
The blood pressure solution kit?
Yeah.
Wow. That is so great. Good for you. Thank you for sharing that, Ginger. I so appreciate that.
Thank you.
All right. Okay, let's look here. I'm just going to hit that mute button. Okay. What else do we have on here? Okay. Julie said niacin. I think we talked about this yesterday, maybe. Can niacin flush kind take the calcium as well as vitamin K2?
No. niacin works primarily on the HDL. The niacin in its conversion, as it's made into niacinamide, which is the active thing that the body uses, it does increase HDL cholesterol, which is one of the few things that will do that. But it does not or wouldn't be expected to do anything about the calcium deposits that are already there.
Jim said, could you talk about the level of concern we should have with a good performance treadmill stress test, but some atrial premature contractions yielding DX of atrial bigamini?
Oh, by Gemini.
Okay.
Okay. So thank you for that question. That's a great question. So what's your level of concern? That's what you want to know. How much should I be concerned about this? Okay, be concerned enough to make changes, because your doctor will tell you this doesn't mean anything. Yeah, whatever, people have this. It's not going to kill you, kind of thing. But it leads down a road. When you first start down the road, it's really easy and nice and everything looks good. And then as you're getting further down the road, you start going downhill. And then it's really hard to deal with. So you're at the beginning of this road where you have a lack of energy in your heart. And that's what causes the premature atrial contractions by Gemini. And that ends up to be down the road atrial fibrillation. And then you need anticoagulants and it's all about energy for the heart, getting enough energy to the heart. Now, we talked a little bit about this before. Your body needs to use about 60% of its energy from fat and 40% from glucose. And if you have insulin resistance, then you're going to diminish that amount of ability to use fat. And so you're going to need more glucose, but you don't increase the glucose much, and you just have less energy to your heart. It lowers your ATP, which is the energy, the energy currency, so to speak. That's the energy exchange, is this ATP. And so you have less of it when you have insulin resistance. So that's an important part of what's causing a lot of people to go into these irregular rhythms and atrial fibrillation. And so heart block and those kinds of things. Your heart needs energy. So how do you get energy? Number one, be insulin sensitive. Insulin sensitivity is something we talk about in the diabetes webinar a lot. And there we have a whole lot of webinars on how to become insulin sensitive. But basically, the simple things to do are avoid sugar, especially avoid, gosh, I was just reading a book on this. It's not all sugar, really. Like most of it is fructose. And we don't think about fructose because it's not really a sugar. Our bodies can't use fructose. Well, we do use fructose for energy, but not directly. It's indirect. It's kind of like a fat. It's used in the body like a fat. So it's not like glucose. Glucose is taken up into the cells and is directly used for energy, and you get 32 ATP, out of a molecule of glucose. Fructose is not like that. It doesn't have that. So a lot of people will use it. In fact, people will tell you that it is a non-nutritive sweetener, that it is a low glycemic sweetener, and that you can use it on a ketogenic diet. And oh my gosh, that is so misunderstood, that fructose is not a low glycemic. It is low glycemic index actually, but it causes insulin resistance, and that's the worst part. So one thing to do is avoid fructose. Where's fructose? Well, sucrose. That's regular table sugar, is 50% fructose. Honey, 50% fructose. Coconut sugar, agave nectar, that's all 50% fructose. And then you have the bad one, is high fructose corn syrup. That can be over 50% fructose. It's variable depending on the processing. So these kinds of sweeteners, especially the liquid ones, are really not good for you. Artificial sweeteners, some of them actually increase your liver's production of fructose. Avoiding the taste of sweet is a good idea to lower insulin. Another thing that can lower insulin is avoiding the taste of umami. If you know what umami is, that's the savory flavor that people really like in like soups and salty kinds of foods, like all the chips that are flavored. They have a lot of that savory flavor, and that's glutamate. If you ever heard of monosodium glutamate, MSG, that is one of the savory flavor enhancers. And that causes you to make more fructose, and it makes you insulin resistant. Go figure. It's really weird. So increasing the energy of the heart by making yourself more insulin sensitive, that's part of it. Another part is making sure you get enough nutrients, the right kinds of nutrients. So you may need to add something like coenzyme Q10, L-carnitine, D-ribose, magnesium. These are things that are common deficiencies that prevent people from making energy in their heart. And then they get these arrhythmia problems. And the doctor at first says, oh, no problem, no big deal. And then when it becomes a big deal, okay, now it's a big deal. Let's deal with it. But then it's kind of almost too late, or it's really hard to reverse that once you've gone down that road.
Very interesting. I actually was looking up umami, and it says the way that they describe the taste, there's two things. It says pleasant, savory taste. And then the other one says it hits the back of your throat and leaves you craving more.
It does. It does. What was the potato chips they said? I bet you can't eat just one. You know, that kind of thing. You need more.
Okay, Gerald says, can LBBB, left branch bundle block, be improved?
Okay. It's the exact same thing I just talked about. So go back and read everything I just said refers to left bundle branch block. That is also an energy production problem with the heart. The left bundle branch is what's conducting the signal from the atrium down into the ventricle. It's a bundle, it's a branch that's kind of like a nerve conduction. And when there's not enough energy, then it's blocked. It doesn't work well. It doesn't reset very well because it has to work constantly. Your heart never can stop beating. So if there's not enough energy, it doesn't reset, and then it's not conducting. And that's called the block.
Interesting. Okay, Mary says, what foods will help get rid of plaque in the arteries? I was told that this happens as you are older.
Yeah, well, it doesn't happen because you're old. Age has nothing to do with it. You can be 100 years old and have no plaque at all. I have had people in their late 80s with zero plaque in their arteries. So don't think it's just age. Yes, it builds over time. So as you age, if you're making plaque, you're going to have more plaque as you go on, just because you're doing more, because you don't stop it. So what foods was the question about what you can do to prevent plaque. The best foods are anti-inflammatory foods, things with omega-3 oils. So like fish, chia seeds, flax seeds, hemp seeds, and that's pretty much all of it. You'll be told that walnut oil is a good source of omega-3, but really it's got 4 times more omega-6 than omega-3. So yeah, it does have a lot of omega-3, but there's also a lot of omega-6. So it's probably not a good idea. Sunflower oil, same thing. And canola oil is same thing, same kind of, yes, it has omega-3, but it has much more omega-6 than omega-3. So that's not really, and the only ones that have more omega-3 are the ones I mentioned: flax seeds, chia seeds, fish oil, and hemp. That's one type of food that is helpful, anti-inflammatory. Another one is having lots of fiber. Fiber in your diet is something that helps improve your cholesterol. It decreases inflammation. It feeds the good bacteria in your colon, and the good bacteria in your colon then get very happy, and they make something called butyrate and a lot of other short chain fatty acids that decrease inflammation in the body and prevent clots from forming. So those are the kinds of foods, high fiber foods, and then things with omega-3 oils. I would say that would be the best thing you could do.
Awesome. I'm just going to put our friends on here for a minute so we can see all of your beautiful faces. Hello, everyone. Let me see here. Julie says, my sisters, both of them have had heart attack. No, I read that wrong. Sorry. I made up words right there reading that. My sisters, both of them have had heart AFib, and my oldest now has tender feet after walking a while. Is this aging, or is this a sign of neuropathy or lack of insulin sensitivity?
Well, yes, and yes. So that's all part of a process. So atrial fibrillation is a lack of energy. If there's a lack of energy, then it's going to affect the nerves. So neuropathy could be a possible thing. And a lot of that happens because of insulin resistance. Remember, insulin resistance blocks you from using fat for energy, and your body needs 60% of the energy to come from fat and 40% from sugar. And so if you block that fat, then you just decrease the energy, and it decreases your ATP. So it's actually, all of those things are important. So yeah, fixing the nerves. We actually have a supplement for repairing neuropathy in the feet, which seems to work really well. And we know it works well because people have come back on the program and they've said, wow, this really works well. It's called Nervala, and it's benfotiamine and alpha lipoic acid, the combination. Each one of those have been shown independently to improve neuropathy. But I'm going to tell you that the supplements are not the end result of everything. Really, the supplements are a help to help repair those. But if you don't fix the insulin resistance problem, you're not going to get energy in there, and it's not going to get better. So you still need to fix the insulin resistance problem. And that may be why the Nervala is working so well in people on the diabetes solution kit. That might be it.
If you want to look for those guys, or if you want to check out some of the solution kits, you can go to Barton Nutrition. I'm just going to show you that website right now. Here it is. You can find, let's just at least go, oh, there we go. There's Nervala right there. So you can just click on that. Use code webinar25 and you'll save 25%. It's one word, webinar25. That's just our gift to those who hop on the webinar. Okay, let me see what else we can ask here. So many good questions are coming in. Someone asked how I can get the Healthy Heart Solution Kit, and is it expensive? Well,
it's super expensive, but it depends on what you mean. Financially, it won't set you back very much. It costs less than a meal at McDonald's, but it's very expensive in terms of it's going to make you change your lifestyle, and that's the cost.
And you can find that at Barton. Actually, go to bartonwebinar.com. I think that'll be the best place to go. Or Barton Nutrition probably has it also, but you can still, it's under $20 for the digital version, which means that you can get that emailed. Yeah, digitally, you'll get that today. And if you use code webinar25, you'll save 25%. So, okay, what else here can we ask? Several years ago, Rita said I had test to speed up heart. Do I need to get another one of these? And what is the test for that she had?
The test for what about her heart?
Speed up her heart.
The test, a stress test. That's what it was. So they inject something like persantine or adenosine, something to cause the heart to beat faster. And then they look, because they're stressing the heart and making it beat fast, and then they're looking to see if there's any like blockages in the arteries that are causing decreased blood flow, that are causing injury or damage to the heart. That test is not very accurate at all. It's not very meaningful. And the reason is because the problems with the heart, like heart attacks, are not from like stable angina, like you have a narrowing, and so when you speed up the heart, you can't get enough blood through that little hole, and that's what they're looking for. But that's not what causes heart attacks. What causes heart attacks are clots that form either in the heart or outside the heart and get into the heart, or constriction of blood vessels. So when you do the stress test, everything looks great, clean bill of health, your heart's great, your stress test was perfect, and then a week later, you have a heart attack and die. And that has happened so many times. In fact, I've known people that 2 weeks after a normal stress test have had heart attacks. Not die, but have heart attacks. Because the heart attack is for a different reason. And so it doesn't really help you. And it is especially not predictive in women. In men tend to have more of like the stable angina kinds of problems. Women have less of that. Women have more of the constriction of blood vessel problems. So that kind of a test doesn't really work well especially for women. It doesn't work well for anyone, but yeah. So a better test would be like do a coronary calcium score, see if you have any calcium deposits in your arteries. If you do, then say, oh, I've got to deal with this. If you don't, then you don't have to deal with it. Like the guy I was telling you about with the blood pressure, 200 over 110, and everybody's like, oh my gosh, you're going to die any minute now. His coronary calcium score was normal. It was low. And so we didn't have anything to worry about. It's like, okay, fine, but you don't have heart disease. Let's find out why your blood pressure is high. And we had time. We've been working on it, like I said, for a year, and finally figured it out.
All right. Oh my goodness, you guys, there's so many questions. Okay, this is from Jim. I think Jim's on here too. I am a type 2 diabetic working on periodic fasting. I'm still taking metformin high, 140 to 150 glucose every morning, and struggling to eliminate carbs from my diet. Am I still on the right track?
Yeah, that sounds like the right track. The intermittent fasting is a great idea. Decreasing carbs, getting sugar out of your diet. Those are great things to do. And they're really helpful for preventing heart disease and for getting rid of insulin resistance and improving your metabolic function. Because the other half of that, remember, you've got to have energy for the heart. And the insulin resistance blocks the energy to your heart. So then that's what ends up with a lot of the rhythm problems of the heart. So yeah, you're doing a good job.
Yes, thank you for asking that, Jim. Julie says, so fructose is worse than sucrose?
Well, sucrose is half fructose and half glucose. So in a sense, yes, fructose is worse than sucrose because sucrose is only half of the fructose. But still, that's a lot of fructose. So so don't even eat sucrose. Yeah, avoid that.
All right. Lily says, I am told to keep blood pressure low because the aorta is 3.9. With blood pressure down and the supplements you suggested, can aorta diameter diminish?
Okay, that's a good question. So the aorta is normally around 3 centimeters or so. It can be up to 4 centimeters is still considered okay. When it's beyond 4 centimeters, then you're talking about like an aneurysm, like it's ballooning out kind of thing. And so you're pretty close to that limit of what might be considered an okay aortic size. So the question is, could it come back? Not likely. That's not what you're looking for. And the blood pressure is not your problem. That's not what causes this. People with very high blood pressure, like 200 over 110, do not have more aneurysms than people who have low blood pressure, like 110 over 60. There's the aneurysm is caused for different reasons, and the aneurysm is caused because there's a weakness, and the weakness comes from the collagen fibers are not strong. They're not holding it very well. So one of the things you can do is to strengthen the collagen fibers is to use sulfur. Someone pointed out to me that rubber is kind of when they first make rubber from like a rubber tree, it's kind of it's really weak. It'll wear out. It's kind of like a rubber eraser. You can just rub it off, and it wouldn't work well for like a car tire. But when they add sulfur to it, to the car tire, to the rubber, it makes a really hard rubber that can wear for 50,000 miles on your car tire, right? That's what the sulfur does. It produces something called disulfide bonds that bond things together, and that's what your collagen needs to be strong. And a lot of people are deficient in this sulfur. It's not easy to get. You have to eat a lot of cruciferous vegetables, have high sulfur amino acids, and you have to eat fresh foods, like go pick it in the garden and eat it. That makes it really good. If it's sitting around, even if it's fresh fruits and vegetables that you get from the store, and if it's sitting around for a week, a lot of the sulfur compounds are volatile, which means that they just off gas and they're lost over time. So some of your nutrition is lost just from something sitting in the refrigerator, such as sulfur. So people who have issues like aneurysms and things like that, one important thing to do is to take a sulfur supplement. And a simple one, it's easy to get, it's non-toxic, you can't overdose on it. I don't think. I think it's like water. You can, but it would take an awful lot. It's called MSM, methyl sulfonylmethane. I know that sounds chemical, and it is a chemical, but it's actually an organic chemical, and you use every part of it in your body. And the sulfur is fixed in such a way that it can be used for improving the function of connective tissue. So an example is my son, who has something called EDS, Ehlers-Danlos syndrome, where he's double jointed. He can actually put his thumb all the way back to his wrist, and his fingers go backwards, and all his elbow goes backwards, and he shows off, and everybody goes, ew. But one of the problems with that is that connective tissue that allows you to do that also allows your ligaments to stretch, and so things aren't very strong. So in order to make them stronger, so he ran a marathon, and his feet were hurting for days. Oh no, it was a couple of weeks, and he's going like, dang, my feet are killing me. So I gave him some methyl sulfonylmethane, MSM, and he said 2 days gone. Pain was all gone in 2 days. Just needed that sulfur. So that's one thing you can do for things like aneurysms.
Very interesting. Okay. Lots of comments on your bow tie today, I will say.
I got it.
Those of you on camera, give them a thumbs up if you like the bow tie.
My daughter bought it for me. She went to France. She ran a marathon. She ran the marathon from Marathon to Athens, Greece. And then after a couple days in Greece, she went to France, and she found a bow tie. She bought it for me.
Love it. Joe said, where is Dr. Saunders today? Looking good with that bow tie. Joe Barton actually has a question. How can you tell the difference between chest pain from heart trouble versus acid reflux?
Sometimes that's difficult. A lot of people attribute their chest pain from heart disease to acid reflux, and they start taking all these acid reflux remedies. They're popping Tums like crazy, trying to get the pain to go away. And since chest pain from heart disease comes and goes depending on how much activity you're doing, how much constriction of blood vessels and circulation and all of that, that it comes and goes, and people think, oh, it went away because I took that Tums an hour ago. That's not the way it works. And it's hard sometimes to know. So, uh, one of the best ways, if it's consistently painful when you exercise. So for example, gosh, when I go upstairs and I get to the top of the stairs and I'm like, and my chest is hurting, instead of popping a Tums, go, that might be a heart thing, right? Because it happens with exercise. With acid reflux, it shouldn't be like that.
Okay. Okay, Sonia or Sonia, I think she's on camera here too, has two questions, wondering about avocado oil, and also how do you fix insulin resistance?
Oh, wow. Okay. So let's take the second one first. The way you fix insulin resistance is to tune in every Wednesday at, what is it, noon Central?
1 p.m. Central Time.
1 p.m. Central Time. And we will tell you how to fix insulin resistance. The simplest way to do it is fasting. So you can fast your way out of any insulin resistance. And the more you fast, the better, kind of thing. So you could do intermittent fasting of a 16-hour fast every day, or you can do 14 days. I had someone do 30 days of fasting and cured his diabetes and no insulin resistance, and his blood pressure came down to normal, and he was perfectly normal after just one 30-day fast. So, that would be the simplest way. Okay, then the first part of your question was, what was the first part?
Avocado oil.
Avocado oil. So avocado oil is a lot of omega-9, and it has a little bit of omega-6 and omega-3. But it has a lot more omega-6 than omega-3. So it's not a source of omega-3. It's a source of omega-9 and has a little bit of the omega-6, omega-3. Omega-9 isn't something you need to be concerned about. Your body can make it. It's not an essential oil. It's the 3 and the 6 are the essential oils. The omega-9 and the saturated fats can be made by your body.
Right. Okay, so this goes back to the branch bundle block. It says, what is the right branch bundle block? Dr. Saunders says, do not worry. It is electrical.
Yes, it's an electrical problem. And don't worry as far as worry goes, but it tells you something that you need to do. So worry about it enough to make some changes so that you can get the energy back into your heart, so you don't end up with other arrhythmias and problems and heart issues. Right bundle branch block, or any bundle branch block, or any arrhythmia, or any atrial fibrillation, or any of those bigeminy, all that stuff, can all be from a lack of energy in the heart. So the way you deal with that is to increase the energy of the heart. And that's what the Healthy Heart Solution Kits, one of the things we talk about in there is increasing the energy, and making sure you're getting enough exercise, making sure you're getting enough of the right nutrients. If you have a right bundle branch block, do something about it.
Okay. Rita said, what is the scoop on metformin? I take 2 500 milligrams a day. My A1C is around 7. The doctor wants to put me on Ozempic. Which is the worst drug?
The worst drug. Okay. Metformin is not bad as far as functionality. People who do anti-aging are taking metformin, and they don't even have diabetes at all. So your hemoglobin A1C of 7 is an indicator that you do have diabetes. Anything over 6.5 is diabetes. So by definition, you have diabetes. The Ozempic is a fad. I'm telling you, it's a fen-phen fad. And it's going to take about 3 to 5 years, and they're going to start saying, oh, well, no, we don't use that anymore because it's really bad for you, because it causes insulin resistance. And so what's going to happen when you stop taking Ozempic? Are you going to take it for the rest of your life and it's going to cause gastroparesis? People lose weight on Ozempic only because they're eating less. That's all. You could do that without taking Ozempic. You could just eat less. Well, why do they eat less? Because they have gastroparesis. It stops the stomach from working. And the stomach just sits there and nothing empties out of it. I had a patient that took Ozempic, and they tested her 8 hours after she'd eaten something, and it was still there. It just doesn't, the stomach doesn't empty out. So you go, I'm full. Well, of course you're full because your stomach's not emptying. So that's why you lose weight. So it's actually not good for you in a lot of other ways. It prevents you from making something called ghrelin, growth hormone releasing hormone, which is another peptide that's really important for getting growth hormone, for repairing your body and fixing everything, including like your brain and joints and mitochondria and all that stuff. So don't, I wouldn't recommend the Ozempic. I'm not going to tell you not to do it because that's between you and your doctor, but I wouldn't recommend it. Metformin it's okay. A lot of anti-aging people are using it because it tells your body, it kind of forces your body to use fat for energy. And remember, you need 60% fat for a day. 60% of your calories or calories or energy needs to come from fat, and then 40% from glucose. And that's kind of what metformin does. And that's why it prevents cancer and prevents heart disease and lowers your, improves insulin sensitivity and lowers your blood sugar. So there are benefits to that. But ultimately, ideally, when you get your insulin sensitivity back to normal, you won't need any of those.
It's better to deal with it naturally, like with the diabetes solution kit that you can find at bartonwebinar.com. We talk about that a lot on Wednesdays. And one thing that Dr. Saunders isn't mentioning, because he's kind, we get a lot of people that send us messages about the side effects of a lot of medicines too. So those are things that we got to always consider as well. Let me see here. Okay, so that was about metformin. Yes, so this is a good question. Someone said it sometime before you said that you could tell us what things mean on your blood analysis. I asked my doctor to print me a copy. Well, I can hardly understand anything on it. There's no cholesterol, triglycerides, HDL, LDL, or anything that I can understand. So frustrating.
Okay. Well, you know what? I don't have a problem with you. Send Leslie an email with your results, and we'll either talk about it on the webinar and go through the results with you, so that everybody else can see too, and they can know what that hieroglyphics is.
All right, I just sent you my email address as well. It's leslie@bartonpublishing.com. Okay, so many good questions here. Someone said, what was the name of the test? I wonder what that was in reference to.
The coronary calcium score. What other test did we talk about? I don't know.
About that one. Paul said, I've had numb feet for 28 years, but it was only 5 years ago that I got my diabetes diagnosis. Does this mean the feeling in my feet is pretty much a lost cause? I still get pains and pins and needles. This means the nerves are still alive, right?
Yes. Excellent. Yes. Okay. Numbness is a bad sign. That means the nerves aren't working at all. And sometimes it means they're dead. But not always. Most of the time they will come back, and pins and needles is a good sign, meaning you actually have some nerve conduction in those nerves. So then in that case, getting remember, don't focus on the sugar. In your case, it's insulin resistance. And you had insulin resistance for many years before your blood sugar ever went up. So getting that insulin down is because insulin caused the problem, you got to get it down to zero. And so all the things we've talked about how to get the insulin down, improve insulin sensitivity, All of those are going to be good, and you can meet us on Wednesdays, and we go over that a lot. And then the other thing is the Nervalo that we talked about too. And we have had people with years of neuropathy come back and get feeling in their feet. Now, just as a little caveat here, think about when your arm is numb because you slept on it overnight, and then you wake up and it's numb, and then the feeling starts coming back into it, and it gets burning and pins and needles, and you're like, we've had people say, no, Nervala made it worse. Well, Nervala didn't make it worse. Nervala is improving the nerve function, so now you can feel things that you didn't feel before, and you're getting those pins and needles and stuff as the feeling comes back in. So sometimes feeling worse is improvement. That's what I'm going to warn you about on that.
Julie says, is intermittent fasting the fasting that you do during the day after 6 p.m. until the next morning? Do you consider that intermittent fasting?
Yeah, you always call that. So, and it's always been that way. Think of what the term we used for the morning meal. We say breakfast, and that literally means break fast. Yeah, because your stomach is empty. So anytime your stomach is empty, you're fasting. That's the definition of fasting. So the idea of an intermittent fast, though, is you stretch it out longer. Instead of just like a 12-hour fast from whatever 7 p.m. to 7 a.m. Or 6 p.m. to 6 a.m. or 7 a.m. To lengthen that time out of fasting, so you quit eating by 4 p.m. So you have only an 8-hour window of eating. 8 a.m. you eat 2 meals, 8 a.m. and 4 p.m. And then after that, you don't eat till 8 a.m. again. That gives you 16 hours of fasting. And that 16 or more hours is intermittent fasting. That's the daily fast, yes.
Okay, last question. Iman said, I had a series of tests to check for AFib, EKG, PET scan, arterial ultrasound on both legs, wore a heart monitor for a week. All tests were clear. Cardiologist wants me to keep taking Xarelto. They want to get cardia heart monitor. Can you recommend?
Yeah, cardia heart monitor. It's I carry one around all the time in my house call bag, and they connect to your phone. You can do an EKG anywhere. The monitor. Okay, that's the implanted monitor. I don't know. Think about it this way: that cardiologists are going to recommend what they do. If you went to an acupuncturist, they'd recommend that you need to get poked with needles. If you went to a chiropractor, they're going to recommend that you get your back adjusted. If you go to a cardiologist, you're going to get a cardio heart monitor and then the Xarelto and the drugs, right? And that's just what they recommend. You have to be the one to say, this is what I want to accomplish. Is that going to accomplish what I want? And then look at your options for what you can do to accomplish, to achieve your goals. And because sometimes people will recommend things that are their goals. It's that, well, this is what I do. You're going to get what I do because that's what I do. And instead of looking at it that way, look at it for what you want. Turn it back to you and make the decision yourself and say, oh, I want to have a healthy heart. Does this give me a healthy heart? Does Xarelto, what does that do? How does that help me? I don't have atrial fibrillation. I don't have clotting. Everything is clear. You said everything was clear. So how does this help? Kind of thing. And just start asking all the questions and focusing on what you want to accomplish.
That's good. All right, Dr. Saunders, thank you so much for.
You're welcome. See you next week.
Yes, bye, Dr. Saunders. Those of you asking about the other webinar, especially those of you asking about type 2, you're really going to want to check that webinar out. That's on Wednesdays at 1 p.m. Central. You can register for that at bartonwebinar.com. So same place will take you to both of these webinars. You'll also find a link for our YouTube channel where you can find all of the replays. We post those there. There are hundreds. And so lots of good information that you're going to want to check out. You'll find information about products. You can use code webinar25 to save 25%. And we look forward to seeing you on these webinars. This is really fun. It's fun to see all of you and get your questions. So that's it for today. Thank you guys. Come back next week. Tell a friend. Tell them to head to bartonwebinar.com and we'll find lots of good information there. So we'll see you guys. Thanks for hopping on camera today, you guys. It was fun to see you. Bye-bye.